accompagné de la chef de l'opposition officielle, Mme Dominique Anglade, de la chef du deuxième groupe d'opposition, Mme Manon Massé, et du chef du Parti québécois, M. Paul Saint-Pierre Plamondon. Le premier ministre débutera par une allocution, suivie par Mme Anglade, Mme Massé et M. Saint-Pierre Plamondon. Nous prendrons ensuite les questions des journalistes qui se trouvent à distance. Monsieur le Premier ministre, à vous la parole.
Oui, bonjour tout le monde.
Welcome, everyone. First of all, I'd like to thank the three opposition leaders, Manon, Dominique, Paul. Thank you to these opposition party leaders who joined me today. I want to thank them. Thank you for stopping maybe for 2020 rather, but in 2021 we'll start with debates and so on, but it's very important for us to be united to save our health network. And today we have 2,183 new cases. This is a record, unfortunately. The only consolation is that when we look south of the border, we see our neighbors had 200,000 new cases. It's as if we would have gotten 5,000 new cases. This is a critical situation everywhere. As we can see, we have to be more prudent than ever. And maybe the most concerning number, it's the number of hospitalization. 1,055 hospitalizations due to COVID. 1,055. More than 7,000 health workers who are on sick leave. So we really have a situation which is extremely fragile. We have employees, nurses, doctors, the whole health staff members. They've been working for the past months, and they're extremely fatigued, extremely tired. The least we can do is think about them and do what we can to help them. And supporting them, helping them means following the guidelines, avoiding making sure that some of us don't go to the hospital because of COVID-19. We've closed restaurants, we've closed schools, and Friday, stores will be closed. But there is something we cannot have control over, what's going to happen in the houses, in the private residences, what might occur there. So I have to be extremely clear with Quebecers. This is not the time to find some kind of trick in order to avoid being caught. This is a time for being responsible. The idea is to help our nurses. The idea is not to clog our hospitals. We're almost on the verge of the limit. We don't want to postpone more surgeries. Remember, this could be one of your loved ones. It could even be maybe you. I mean, this has impacts on all of the eventual patients of the healthcare system, the network. There's a vaccine around the corner, yes, but the number of vaccines we receive, it's limited. We've received 4,875 doses, and we will receive 50,000 new doses and 29 additional doses in a few weeks. That's all that's been confirmed, 84,000 doses. We're talking about being able to give the vaccine to 42,000 people. This is extremely limited. It means that in the next weeks, the situation will remain critical. And that's why the four party leaders have joined forces today. They all joined us today, and they will come here and ask you to follow guidelines, health guidelines, and to work with us, especially in the houses. As we've said, the only thing that's allowed for is to invite a person that's alone. You cannot invite friends, a second family. I understand this is not interesting. I mean, you want to see your friends that you haven't seen for a long time, but this is not the time to do it. Even though if it's allowed, this is not the time for going to southern countries. I mean, with the federal government, government of Quebec will make sure that we enforce strict measures to follow up on people when they come back from their travels in southern countries for their quarantining. So I want to say a few things about the people who live alone. This is extremely important. We know that during the holidays, it's always a difficult time for people who live alone. This is the time when we start thinking about people that are no longer here. And after many months, these people have not seen many people. So call these people. You can invite some people, one at a time, if they want to, of course, if they live alone. I understand that some elderly people prefer to remain home because they fear being infected with the virus. But we have to respect that. But we have to work together. We have to respect that. We Quebecers can do that. It's important also, considering children, it's important for them to go outside of the home for outdoor activities, but they have to be prudent. We have to keep respecting the distancing. So in conclusion, we have 4 opposition party leaders united, working against the virus. We are working together. The 4 party leaders are sending the same message. This is not the time to do parties together. We can achieve this. We can be successful. There is hope. Eventually, vaccine will be available to greater numbers of people. And we're seeing the light at the end of the tunnel. Will be more people reaching that light. Of course, we have to admit we haven't succeeded yet, but we can make the difference if we remain united. Again, thank you to the 3 opposition party leaders.
The opposition for being here today. We're all together to save our health system. We need to help our health workers, and the best way to do is by following the rules to avoid increasing the number of COVID patients in our hospitals. We're already closing schools and businesses for the holidays, but we can't control what's going on in houses. The next few weeks will be crucial. That's why we're united today to ask you to follow the rules. Quebecers need to stick together more than ever. In our homes, we can only invite a person who lives alone, not a second family and not a group of friends. I know we would all like to see our friends, but we have to make one last effort. That being said, we need to help people living alone. We should call them, see them, invite them, but also stay careful. We have to be there for each other. We're all in this battle together, and today the leaders of the 4 parties have the same message. Please follow the rules and don't invite friends in your home. I'm convinced that we can win this battle together. We see the light at the end of the tunnel, but the virus is still very dangerous. We have to stay careful to get to the end of the tunnel together. Thank you. Maintenant, je vais passer la parole à la...
I would like to give the floor now to the Liberal Party leader, Dominique Anglade. Thank you all. Good day. I'm extremely happy to be with all of you this afternoon, with all of the leaders. I'd like to thank, first of all, the Premier. Thank you for these weekly meetings. This is resumed with the 3 opposition party leaders. This enables us to discuss the issues while we're not at the National Assembly. I'd like to thank the leader from the 3rd opposition party to have proposed to hold this press conference. Beyond our disagreements, it's important to do that. In politics, we say that there are arguments between the different party leaders and parties all the time. But the message we want to send today is that beyond those struggles, we remain united. It's not our differences that matter. It's what unites us. And what unites us is the challenge we face, COVID-19. On the eve of Christmas, during the holidays, with a more critical situation, of course, we see that statistics are increasing, and so we see the new cases and so on. We want to mitigate the situation, and we want to bring those cases down, and we want to be stronger after that. New cases, well, the situation is quite alarming. Our health system is suffering a lot of pressures. It's been doing so for a long time, and we're on the verge of disaster. But we have to understand that people are stressed out. A lot of our People are frustrated, fatigued, angry, tired, but these feelings should not win over our resilience because otherwise, the virus will win. We don't want that. We want to limit the spread of the virus. We want people to comply with the sanitary rules, follow the rules, and we want everyone to respect the guidelines, and we have to go through the holidays in spite of the restrictions, but complying with the public health guidelines. Since the arrival of COVID-19, there are a lot of small things we can do, banal things like giving shake hands or giving a hug, things like that, things we haven't been able to do beyond or outside of our own interpersonal bubbles. And so people want to do that. People are fatigued. And since we're getting closer to the holidays, from a mental health point of view, from a morale perspective, it's harder for people because people haven't been able to do these things, small little things. And I'm specifically thinking about the great parents who won't see their grandchildren, the aunts, the uncles, cousins, and so on. You won't be able to see those family members maybe. And of course, it's hard on the morale, but we have to work harder together still. I'm thinking about people who are concerned. The fear when they're looking at their future, the fear they might lose their jobs. There's cases of violence, people who are living alone, who live isolated, and so on, people who cannot see their friends, children, for example. And all the frontline workers, those that are the frontline workers working the health sector, I was thinking about them specifically. And all of us together, we can think about them. And so this can encourage us to work together stronger. The bigger family meetings won't be held this year. Some of us will have an opportunity to remain within their own interpersonal bubble to celebrate with their children and so on. But some people will remain alone. Some people live alone. And please, make some calls. Make some phone calls to call these people. I've received a list of 20 people on my list of people that I have to call for the 24th and the 25th of December. Les Petits Frères, it's an organization. They're looking for people. If you don't know what to do, I mean, call these people living alone. This is an act of solidarity. These solidarity deeds make the difference. And this enables us to spread the magic of Christmas as opposed to the virus. And so we have to encourage people to do things like that.
We all here today, despite our political views that are very often different, but today we are united because we want to make sure that people follow the public health regulations. It is really critical. We're entering a phase that is very difficult for all Quebecers, and we believe, as leaders of our respective parties, that it is important for people to realize what's going on right now and to make sure that we follow those rules. I have I'm thinking a lot about the people that will be in our healthcare systems during the holiday season, that will be looking after sick people, and I want to make sure that we can support them the best we can. But the best we can is really supporting those roles. And perhaps finally, just a message to all the people that are vulnerable, the people that are alone. If people are able to place calls, to make a phone call and make a difference in the lives of those people during this holiday season, I think it will make the world of a difference. We're all in this together, so let's make sure that we go through this period together. So thank you very much, and je vais maintenant céder la parole à la chef du deuxième groupe d'opposition.
I'll give the floor to the other opposition leader, the second group. Good afternoon, good day, everyone. Thank you, and good day to all the other party leaders and to the Premier. We are here, it doesn't mean that we think the same. If I'm here, it doesn't mean that I never argue with the Premier. Quite on the contrary. It doesn't mean that I'll stop from now from having arguments. No. But for me and for my political party, it was extremely important to be here today because there are people that on a daily basis get up in the morning or get up at night and they go help our healthcare system in CHSLDs, maybe in hospitals, for the tests, for the labs, for assessments and health evaluations and so on. There are people that risk their life on a daily basis, and I'm here on behalf of them and for them. I joined my voice to the Premier's voice and to the opposition party leader's voice. It's not because because I want to obey, or it's out of solidarity, because of solidarity vis-à-vis these people who do not hesitate 1 second on a daily basis to put their life at risk to help our Quebec citizens. It's super important for everyone to do what you can do. Do your share. It may be small, but please follow public health regulations. We are tired, we're fatigued. Of course, our mental health has been suffering for months. And really, it is so. But if our system is suffering and faced with all types of issues, and so because of the disease, the situation is dramatic already, but it will be even more if we do not help them. So that's why I wanted to be here. It's important for me to be here to make sure that these people can feel that there's solidarity. This solidarity is needed if we want to support as much as possible these people. And I'd like to tell you, well, during this holiday time, of course, every day I'll think, first of all, I'll think about the sick people, the people who suffer from COVID-19 or who suffer from other types of disease or illness. It's always a hard time, the holidays for these people, and also all the healthcare people who deliver those services in our facilities. I'm thinking about them. I'm thinking about all these people who want to get to the finishing line. I mean, there's people who don't want to follow public health regulations. Don't do that. It's not about endangering your own life. It's also about putting at risk other people. So don't do that. Don't cross that other line and follow public health regulations, because other people might pay the price if some healthcare workers are no longer available, if they're no longer there. I'll try to go outdoors, of course, and our healthcare system needs us to go outside. Fresh air is needed by many people. Of course, don't gather together, but I'll go outside. Outdoor activities are very important. I'll go play with my dog. I'll do like my grandmother. I'll open the doors and windows in my home to let fresh air, recycle the air in my house, and I want to also breathe fresh air in my lungs. But I'll think also about my family. I won't see them. I'll think about my children. They're far. My father, my brothers and sisters. I'll have them in my heart. We'll use our technological tools. I'll talk to them thanks to those tools. Why? Because it's very important for us to remain in solidarity with the people that are supporting our healthcare system, and they're working extremely hard for that, so we need to support them.
I'm here today with the Premier to said to everyone that solidarity, it's really important for now, and it's important for the workers who every day work on the healthcare system. And I hope that everyone would respect the sanitary measure to be sure to take care of people who are taking care of us. Merci. Je passe la parole maintenant au troisième.
I'd like to give the floor to the third opposition party leader, Mr. Saint-Pierre Plamondon. Thank you very much. Manon. First of all, I'd like to thank the government. Thank you for accepting this request. It's a request so that we can work in a united way. We could all speak from one voice then through this process. So this is the end of the process. There's a sprint that must be provided in this context. Our efforts save lives, but this is out of respect for the healthcare workers also. They're holding the fort, they're persevering, they're working extremely hard, they're looking for us They're extremely tired. So if they're tired, we want to give them some respite, some help, because they're supporting us during the holidays. Christmas, it's a time for remembering our traditions. It's part of our traditions. It's not just a holiday. It evokes a lot of ideas and values. And one of these ideas is that the money we've lost or earned during the year and all the gadgets we've purchased during the year don't really matter compared with people. People have dignity and they have an intrinsic value. That's why during the Christmas time, we think about others. We think about people. People matter more than trinkets. And so we need those values during Christmas and the holidays, because specifically this is a very hard year. Dominique was referring to the elders. They won't see their grandchildren. It's the case in my family. There are Quebecers that are waiting for surgeries. They hope one day to get good news. Entrepreneurs, restaurant owners, those that are facing an extremely hard year financially speaking. Our teenagers, they're not socializing as usual. The young people, and all those suffering from a life of solitude. Well, for most of us, this may be a first time we experience isolation or living alone. But for many people, this is normal. They always live alone in one way or not. But maybe this crisis is an opportunity for us to challenge things about solitude. We can ask questions about our society. It's not normal to be so egotistical as not to think about other people. This is an opportunity. During the holidays, we can act concretely. It's not adversity. We're going through adversity right now. This defines us now. It's uniting us in a way, but we don't have any control on the situation. But what really defines us beyond that, it's the way we'll react in the face of adversity. And I suggest we can react with love and positive actions. But this is not just thoughts. These are actions you can do on a daily basis. Call people you know. Call the people that you had arguments with during the year. This was not an easy year for anyone. This has put a lot of pressures on our families, created some arguments that should not have happened. Just call people. Call the people that you had disagreements with and say, look, we may not agree, but I'm thinking about you. I care about you. Like, do anything, sugar pies, send Christmas cards, tell people you love them. And if you buy Quebec products, it means you take care of our people. Buy locally. And the local company will benefit from your decision to buy local. So Christmas is also a symbol that can help us. The new year also is a way for us to say we're starting again from scratch. We can restart everything and be on the right track so that 2021 will be on the right track, will be more positive right now than whatever case statistics show us. In Quebec, we have this resilience. There's this strength of character. This is the very end of this process. There are great news that await us in the new year. I'm certain of that. So instead of choosing despair, let's choose hope. Let's choose resilience. And the best way to do it is to start 2021 with concrete actions, like doing the best we can to prevent contagion, transmission of the virus, and let's send love to the ones around us, to our friends, or to the people who are faced with difficulties or people who live alone. Thank you. This will be a question period now. So one question per journalist. So we have virtual questions from journalists, and please direct your question to one person specifically. Patrick Belrose from Le Journal du Québec. First question. This is for Mr. Legault. You've said it well. This is not the time to travel to southern countries to go on vacation that way. But we know some people have reserved their plane tickets, and that's precisely what they will do. What do you have to say? What's the message for these Quebecers who leave the country and they're going to southern countries? And so what's your message so that they follow the health guidelines and quarantine themselves when they come back? We do not recommend Quebecers to fly out of the country unless it's absolutely necessary. We told them not to travel and go outside of the country. Now, this depends on the federal government. I've been repeating this, by the way. What we're doing right now with the federal government is to make sure that we have very strict measures when those travelers come back, so that quarantines be complied with, so that we follow up on those people, so that we call all those passengers traveling abroad. We want to make sure of that. And we will remember what happened in the month of March when people came back after the school holidays. We don't want this to be a repeat, so we'll ensure that this is followed up on by the federal government. If it's necessary, we'll add staff. So if we need more staff people dealing with this, we'll have more people than just the federal people. Question. Would you have preferred for airports to be closed? Because it's like a dual message here. We're closing restaurants in Quebec, but then people leave the country, go to southern countries, and then come back. Answer. This doesn't depend on the Quebec government. Number one, I said it. Number two, we have to find the right balance. Some people go to Florida for all sorts of reasons. They travel there for their own mental health, maybe. So what we're saying, at least be prudent. If it's not necessary, don't go, don't travel. Question from Hugo Lavallée, Radio-Canada.
Oui, bonjour, vous m'entendez bien?
Good morning, good day. Do you hear me well?
Sur le même sujet,
This is about the same topic. Mr. Legault, I have a question for you. Doug Ford, the Premier of Ontario, yesterday was very strict. He said that airports were like roofs with leaks, referring to the Prime Minister of Canada. He said that he will do road screenings and he will circle or shut some zones around airports for those traveling abroad. He condemned the Prime Minister of Canada. Do you envisage anything like that, or will you do the same thing as Mr. Ford? We don't exclude anything. All options are on the table, but we're in the same situation as Mr. Ford. Question. It means you're not satisfied by the federal government? We want to have more information about the follow-up measures. This is with the different passengers or travelers, but it seems that there are a lot of those. So the follow-up measures, we want to have more clarity about that to make sure that the quarantining process is well followed. Question from TVA Nouvelle.
Est-ce que vous m'entendez bien?
Do you hear me well? My question is for the Premier. It's always about the same topic. Will you have legitimacy in terms of the government in order to close travel agencies, the same way you close some restaurants in order to prevent Quebecers from leaving the province? The answer, the province, it doesn't deal with the borders. This is a matter that pertains to the federal government. Closing or opening borders, this is about the federal. Yes, but these agencies are in Quebec. Answer, if the airports are open, it's very hard for us to prevent travel agencies from selling tickets. A lot of travelers purchase their tickets directly online, so they use the internet for purchasing tickets. So I don't see why we would block the activities of travel agencies. Follow-up question. The Public Health Institute of Quebec wants to see why so many health workers are infected by COVID-19 in spite of all the protective gear and equipment. There will be an investigation on that also. Has the government thought about that? Have you made requests to the public health authorities to see why we have such a situation whereby a lot of health workers are infected? Yes, we've asked a lot of questions to the public health authorities, and so I've made a commitment. We'll share the data as soon as we get them. I've made an undertaking of that. It seems that many contagious situations were not due to the presence of patients in the hospitals. So we want to see where the virus was contracted, and we want to see how the health workers have been
Oui, bonjour. Est-ce que vous m'entendez bien?
Oui.
Très bien. Alors,
contracting the virus.
c'est tout à fait légal présentement de voyager dans le sud. Mais
Question. I understand it's totally legal to travel and to go to southern countries, but is this a moral thing? Answer. It's not recommended.
Aller dans un
To go to Punta Cana or to Cancun in a, all-included club and to be amongst other people very close by from other people, it's not desirable a situation. In certain cases, I suppose it's possible to follow the guidelines, the health guidelines. But let's say that it's tempting. I mean, it may entice people, and people might be led to not follow health regulations in those situations. When will the health network reach a point where they'll have to opt for the intensive care triage protocol, when doctors will have to make extremely hard decisions, when they will decide to refuse taking care of one patient in order to take care of another one? Answer. We are very far from that situation. But of course, if there's a huge increase in the number of hospitalizations, it means that we'll have to postpone more surgeries. We don't want that. But there are no scenarios where this is planned, a situation where we would have to choose between some patients and other ones because of the urgency of the situation. There's no plan for that. Question from Journal Métro. Good day to all of you. My question is for the three opposition party leaders. Since recently you've held some weekly meetings, I don't know if you've held more than one meeting with Mr. Legault. I want to know, what requests have you made with Mr. Legault, and how were you welcomed? How were your requests received? Welcome. We've had a first meeting last week. The second meeting happened right after the press conference. And so each party leader asked their questions. And so these were questions about ventilation, and these were questions about testing, vaccination, and so on. We'll clarify the situation. This is not a National Assembly session. This is not the question period, at the National Assembly where you can ask those questions. But this enables us to get answers about what our citizens have, the questions that our citizens would like to ask. So this was a cordial meeting, and we want to find answers to some of these questions, and we want to propose things that will or would create some progress in this situation. Things are going well. I think we have another call. This is for Tuesday. Next Tuesday, there should be a call also like that. I don't know if you all want to react. Things will be added. Ms. Massé, you have the floor. Thank you, Mr. Carabin. Dominique has given you the general presentation of the situation. But as for us, well, personally, I would say that one of the concerns that Mr. Legault knows that is important for me. It's the whole matter about protecting workers, protecting all the essential workers, everyone working in the field sector, the health field, the health sector. I asked for more information also, because I had the same question, by the way. I wanted to know, how are things happening? What's the infection situation regarding our healthcare workers? Because all the airborne transmission is quite concerning. We're waiting for reports, and Mr. Legault made a commitment in regards to this file. So he's made an undertaking that he would provide us answers on that. Now, also today, we realize that sometimes it's necessary for us to be together, to have a discussion when time comes for us to show solidarity vis-à-vis our frontline workers working on a daily basis. That's why, for me, those that travel to the southern countries, this is hard for me. It means a lot of people can pay for those travels, and means that also some people can't even cross regional borders in Quebec. And I think it's a hard situation. Think twice, please. I ask everyone to think twice about this. If not, really follow the quarantining measures and regulations when you come back, if you have to travel outside of the country. I want to confirm that this is a process that's useful. Sometimes the opposition party leaders' role is hard to understand. The idea is not to create arguments, but the idea is to prevent problems or to raise elements for the creation of solutions, things that were not considered. So we had a meeting this morning, and I had questions about the new virus, the new variant of the virus, the new strain. So we have questions like that that we raise. These are useful questions that we might raise on a weekly basis. It's a substitute for democracy in a way. But democracy is useful even in times of crisis because it can shed some light on the situation that occurs. So thus we can make proposals and we can ask questions, and this was very fruitful. That's how we've done it. Follow-up question? Yes, Mr. Legault, I haven't forgotten you. The Treasury Board yesterday was talking about the performance indicators regarding the 20 governmental departments. The health department has only complied with 38% of its strategic objectives. What we've learned is that things went backwards regarding the number of hours for which patients have to wait in the emergency room. So considering those indicators, what's your responsibility specifically about how the situation is in the healthcare system as the pandemic situation is lived in Quebec? Answer, to be quite honest with you, I haven't seen those results. And second of all, we have to understand that 2020 is a year that's changing a lot of indicators and results, respectively. So our objective during the mandate, as we've said, is to reduce the waiting time in the emergency rooms. We need a new agreement with the Family Physicians Federation, the FMOQ. We started the discussions during the pandemic period. But we want to resume that. My intent, and by the way, I've talked with the health minister recently about that. Our intent is to go back to this priority and to ensure that we reduce the waiting time in emergency rooms. Regarding responsibility, regarding what happened in the springtime, as I said, indeed, there were some significant flaws in the CHSLDs. So I'm partly responsible for those flaws. Question from La Presse. Question from Ariane Lacourcière, La Presse. Is this working? Ariane, go ahead. Good day. Do you hear me? Okay. You've talked, Mr. Legault, that it's important for people not to gather during the Christmas time so that the healthcare system doesn't cancel surgeries. Do you have a threshold regarding the number of cases or the number of hospitalizations beyond which it won't be possible for you to reopen schools, businesses, restaurants? Do you consider that in your equation, Is there a threshold? Answer, there's no magic number, a threshold, no. But we've been entertaining this throughout our discussions with the public health authorities. We have to look at the specific situation that prevails in each capital region in Quebec. We know that the greater Montreal region is severely impacted. That's where we're looking at things more carefully. We're looking at this situation more specifically. Now, we have to look at the trends. We have to look also at what is possible, what's not possible, regarding what we can postpone in terms of surgeries, for example, or interventions. We have to look at the dates. We hope to be receiving other confirmations regarding the vaccine or vaccines, because as soon as we start providing vaccines to residents in CHSLDs, this will create a huge change in the global situation, comprehensive situation in Quebec. For now, we don't have enough vaccines in order to give ourselves a certain date for all CHSLD residents when they would all be receiving the vaccine. So there are different factors here at stake. We will take stock of the situation in the coming weeks. Follow-up question? Yes, the number of beds for hospitalization during the first wave, 8,000 beds were made available by you. Now we are at around 2,000 beds. Do you still have a capacity to go beyond the 2,000 beds if needs be? We had created some space for 6,000 beds and so on, but we had postponed all the non-urgent surgeries. But we have to understand that things are accumulating. Whatever was postponed in spring is added on onto whatever would be postponed currently. So the leeway is not as good, but we think that 2,000, 2,500 beds, it's like a maximum level that we can use right now. We have a question from Cogeco Nouvelle before we get the English questions. Regarding the employment insurance, for those people that have lost their jobs, will they lose 1 week for the aid they should get? This is about the benefit. Answer, I don't have the answer on that, so maybe we will study this and then we'll answer later. I'll come back to you on that. Question from the Gazette in English.
Is it working, Phil? Okay, we will switch, in the meanwhile, we'll switch to Gloria Enriquez from Global News.
Good afternoon. What's your message to shoppers crowding into malls and shops ahead of Christmas?
First, we've reduced the capacity in different malls and even retail stores. So we make sure that those capacities are respected. Second, I'm asking people to be careful. So wear your mask, stay at 2 meters of other customers or employees. So I know that in some stores, in front of some stores, there are long waiting list of people. But right now it's important that we be very careful in retail stores until Thursday. We're closing them Thursday night.
Thank you. And veterans in St. Anne's Hospital are getting priority when getting the vaccine. Is it because you listened to the opposition?
First, I'm from St. Anne, so I've heard about the situation by some people I know in St. Anne de Bellevue. I think that even if it's an hospital, it looks more like an CHSLD, so it'll be treated like a CHSLD, so people will be vaccinated in priorities. But yes, I guess from opposition and from journalists, I think that this good question was raised and we're taking action.
Just a reminder that if you want to ask a question, you just have to raise your virtual hand. We'll go back to Phil Autier from Montreal Gazette.
Phil is already in holidays. Yeah.
Hello.
Okay, Phil.
Hello.
Hello. Sorry about that.
Okay, Phil. We were talking against you. Yeah.
Yes, I heard you. Yesterday, Mr. Ford said that he's ready, if necessary, to take his own means to control travelers coming back from other countries, even testing. He talked about even having hotels where they could be quarantined in Ontario. Are you willing to go that far, Mr. Legault?
Yes. We had discussion with the representative of Ontario, and we both worry about quarantine. We want to make sure that it's done properly, that we make sure that we have people doing the follow-up to make sure that it's respected. If some people don't have a place to stay during 2 weeks, we're also open to look at the possibility of using some hotels. We have many of them available in Montreal.
And in this morning's vaccination results, there was a finding that showed the Capitale Nationale had done 3,000 vaccinations and Montreal only 2,110. Are you encountering logistical problems between these two cities for getting the vaccine out?
No, I think that right now many of them are calling. They were all looking for more doses. So it's a question of, because boxes have 975 doses, we have to find CHSLD where we can vaccinate at least 975 people, because we cannot, when the box is open, we cannot transfer part of the doses to another place. So no, I think we started in Montérégie and it's going well. The only thing we're missing is the quantity of doses.
We'll switch to Valeria Cori-Manacchio from CBC News.
Hello, can you all hear me?
Yeah.
Excellent. So my first question is to Mr. Legault, but the leaders of the opposition could also answer. So you four are presenting this unified front here today, just days before Christmas. Why was it so important to send this message, and why does it come so late?
But I think that the situation is more critical. We have a record of more than 2,000 cases today. I think that we've decided to close businesses, schools, but there's a place where we don't control the situation, which is in houses. And I think it was a good suggestion from Paul Saint-Pierre Plamondon, and we all agreed to have this press conference today together.
Do any leaders of the opposition want to answer or say anything?
Sure. I think what you're seeing today is also the result of getting together, talking with all the leaders. The fact that we're not sitting at the National Assembly doesn't allow us to have those conversations if we don't have those regular meetings. So in our first meeting, this was proposed. So the idea here is to maintain those conversations until we go back to the National Assembly and try to work together as much as we can in order to fight against the virus. So again, it's our ability to get together and work together that delivered that result today.
And my next question is for Premier Legault. Why are the PAB candidates who failed the program being forced to pay back the government in the middle of a pandemic when people who fail out of CEGEP don't have to do the same?
Okay, it was part of the deal at the beginning. We have to remember we had 80,000 applications. We've asked people if they were ready to follow a 3-month training. Also, we were able to have about 7,000 following lessons from June 15 to September 15, and then we have another 3,000 that should finish their training somewhere by the end of January. Of course, some of the people decided that they didn't want to accept the job anymore, so it was part of the deal to reimburse the money they got when it happened.
And we have a last question from Angela Mackenzie from CTV.
Hello, can you hear me?
Yeah.
So many experts are saying that a 2-week lockdown after Christmas isn't enough. Would you consider extending?
Okay. First, we have to remember that some measures were in place since October 1st. For example, in restaurants, when we talk about gatherings in houses. Of course, when we discuss the different scenarios with the public health, we looked at the possibility of having 1 week, 2 weeks, 3 weeks, 4 weeks. Of course, the longer it is, the more efficient it is. But we have to balance that with mental health, with the economy. and we decided that, for example, schools will be closed for 3 weeks. We've asked offices to be closed also for 3 weeks. Some of the places we've asked so far for 2 weeks. We'll look at the situation. We'll try to have an update during the week of January the 4th. We hope that it's not necessary to have restrictions longer than after June the 11th, especially for schools. I think it's important that our children go back to school on January the 11th. But of course, we'll follow up the situation. But we hope and we think that if all Quebecers respect restrictions, it must be enough.
Okay, and I have a follow-up question as well about vaccines. In the daily update that was sent out today, I noticed that the doses of vaccine from December 21st were 437, only 115 on December 20th. Why are the numbers so low compared to previous days, especially considering we now have more vaccination sites? And is there any concern that vaccines will be wasted? I understand they have to be used fairly quickly once they're thawed.
No, there will be no vaccines that will be wasted. As soon as we receive them from the federal government, we use them. But I think your question, you would need to ask that to the federal government, because we're ready to do something like 200,000 vaccinations a week. So, of course, we don't receive this kind of number right now.
Merci beaucoup tout le monde, c'est ce qui met fin à la conférence de presse.
Thank you very much, everyone. And this is the end of the press conference.